I'm Robert Durden. I'm sorry I couldn't make it today, but I wanted to weigh in on the question that you guys are talking about today is, are we going to be able to figure out a way to get Medicare for all on a national basis? And do we do that by going to the ballot box harder, or do we need to focus more on mutual aid, stuff like that? Now, when I started PFC, I was fully on board with democratic reformationism and getting as many squad members as we could elected to Congress. And as the year has gone on over the last 14 months since Joe Biden took office, I have made an absolute flip because I've been cataloging exactly where the squad could have utilized leverage to get what they want, and they haven't done anything to actually help the people. In fact, there's been over 10 times where there was a vote that they absolutely screwed up, or they voted just ever so correctly to allow something horrible to happen, and they could have used that as a leverage point to Joe Biden. Some examples of this are like the Capitol Police budget was close, Iron Dome, the Invest in America Act, which was the corporate giveaway Republican-written infrastructure bill, that was a narrow margin. I could go on and on. There's plenty of places where they could have used Tea Party tactics to get Biden to actually do executive order. There's a part of Obamacare, the Social Security Act, Section 1881 Alpha, where via executive order you can extend Medicare for all to the entire populace of the United States because there's a pandemic going on. They did this in Libby, Montana because of asbestos. They did it in Texas when the blizzard hit and it knocked out their electrical grid and there were people dying. They all got Medicare for all because you can do that, and the squad could have forced Joe Biden along the way, or at least fought for him to do that executive order if they wanted to. They have not even really tweeted about it over the last year. And so I do not believe that going to the ballot box is going to be the way to get us what we want. Putting more squad members in there, I don't think you're going to be able to do it because nobody really trusts the squad to get anything done anymore. In terms of Medicare for all, they already flubbed the force the vote. They didn't utilize leverage, and it would have been super easy to force the vote on Medicare for all. They didn't do that. They haven't used their leverage Tea Party tactics to make Joe Biden give us Medicare for all, and they certainly haven't done anything in Congress to actually push Pramila Jayapal's bill, meaning it already wasn't going to pass the House. They're not doing anything to get it to pass the House. They're also not leveraging any senators because they could. Via their social media apparatus is very big. If they wanted to make Joe Biden go after Joe Manchin, or even attack Joe Manchin publicly to get something like a Medicare for all bill, they could. They're not doing that. They're not doing that. Now, there is an answer, I believe, to how we can actually get Joe Biden leveraged, and it comes via going outside electoral politics. I imagine this summer will be filled with protests via anti-war protests if this thing with Russia and Ukraine keeps going on, anti-mandate protests similar to the trucker convoy up in Ottawa right now, and I think it's going to be maybe a very slim chance that we can get a general strike going. If we can figure out what the spark is and roll with it, sort of like what's happening in Canada right now. If there's a worker uprising, and I don't know what it's going to be about, it could be one of the two things I mentioned. It could be anything. Could be anything. If we get something large, like the Black Lives Matter protest going, but actually make it more targeted, like what's going on in Canada right now, shut down some transportation spots, use the ink blot military tactic and shutting down transportation areas to actually get what we want, theoretically the people via a general strike could actually get Joe Biden to give us Medicare for all via executive order. I think that more likely than the squad and the Democrats actually doing it. They're not going to pass it. They'll blame the parliamentarian or the filibuster, or somehow they'll blame the Republicans, or they'll blame the Supreme Court. They'll rotate the villain, Manchin, Sinema, whatever they have to do. They won't do it via Congress. We might be able to leverage Biden to do it if we do a general strike. Now, the last evidence I have that it's not going to work at a state level either is the recent filibuster proof, if they had a filibuster, state assembly in California, which let Assembly Bill 1400 die. They have 70% Democrats and a supermajority, like a mega supermajority in California, and they didn't even bring it up for a vote. So any argument you have that we need to vote harder, put more Democrats in, or put more squad members in, I don't see any evidence displayed to me that that actually can work. I think that if you want to get it on a national level, We have to, in this next year, before the Republicans take over the House and the Senate, while they still have a majority, we need to exert as much leverage via protest this summer as possible. Perhaps we'll get some sort of general strike going, and we might be able to negotiate, if not universal health care, maybe he'll finally give us a public option. We'll meet in the middle. I don't know what's going to happen, but it's never going to work unless we have a very strong outside game. The inside game ain't working. There's no evidence you can give me that the squad has stood up to the Democratic elites even once. So to elect more squad members or vote harder is, to me, kind of a naive concept. It reveals to me that you have a lot of faith in the Democratic Party, who has not done a damn thing for us over the last year. So if we want to get this done, it has to be via mutual aid, direct action, and we have to ride protests and create and organize protests this summer, and maybe we'll get lucky. Thanks for having me, guys. I'll talk to you later.
Hey, Joy asked me to put this video together for her Medicare for All event this weekend. And I gladly accepted because I would like to see home and community-based supports, a universal home and community-based supports program put into a Medicare for All program in the United States. The reason being is, well, our family was wrongfully terminated from our home and community-based supports about 3 or 4 years ago by Amerigroup. And because of that, I started to look around and really started investigating the Medicare privatization of our Medicaid system. What I've found out, I'm not really happy with. I did some digging on the wait list increase. And our wait list here in Kansas, according to the Kansas Department for Aging and Disability Services, in January of 2021, it was at 4,493 people with IDD, intellectual and developmental disabilities, waiting for home and community-based supports. In November of 2021, which is pretty much the end of the reporting period, it ended at 4,622. So this waiting list grew by almost 200, just shy of 200 people, under 200 people, in just January, February, March, April, May, June, July, August, September, October, November, in just like 10 months' time. So, and that's just the people on the waiting list. That does not even address the time that people are spending on this waiting list here in Kansas. The people on this waiting list are spending at least 8+ years on this waiting list, which is ridiculous. Now, we need funding for this at a federal level because we cannot count on the states to do what is right by people with disabilities. In 2021, the budget analysis was released, and according to the budget analysis website, the agencies who are in charge of the IDD waiver requested $16,842,875 for the reduction of the wait list. It didn't get a dime from our governor, who is a Democratic governor, by the way. We have snakes on both sides of the aisle here. So the IDD waitlist got no money this year. And as far as I know, The IDD Employment Services also did not get any money. The agencies that administer employment services for people with IDD requested $21,980,880, and the governor did not give any money to these agencies also. And it looks like the PD, which is physical disabilities waiver, wait list reduction, did not get any money either, which they requested $3,180,995. So IDD Employment Services agencies didn't get any money. IDD waiver, wait list reduction, management services, whatever you want to call them, didn't get any money. And physical disabilities wait list reduction agencies got no money. So didn't get any money. Sorry. So, like I said, we can't count on the states to do what is right for people with IDD. We need a federal program that, and for anybody who out there who may be a constitutionalist or a states' rights person or whatever, in this case, we need a system to where the states can be bypassed and people with intellectual developmental disabilities like my son and our family can get the help that they need further up the chain of command. Not only that, with a universal home and community-based supports system, we need better training for care attendants. We need a universal training model for them. They need better pay. And families like mine who can't work because we don't have a care attendant to help us with our disabled loved ones, we need some real help too. If we're not going to get able to get back on the waiver, then somebody needs to help us out too. So, I keep beating this drum here in Kansas, and I don't know what else to do. I just keep talking about it on social media. I've gone on then Hair of the Dog and talked about this. I've talked about it on the Lone Wolf podcast. I've talked about it during a disability panel with then Fred Hampton leftists with Jay Buffon. I talk about this anywhere and everywhere I can think of to talk about this, because people with intellectual and developmental disabilities in this country are getting left behind. My son is one of those people, and I'm fed up and pissed off, and families like ours need some help, need some results. So thank you again, Joy, for letting me come on and talk about this. I'm not a professional public speaker. I just speak from my heart, and I speak with facts. And I'm willing to provide links to where I got my information from to anybody that wants to see the information firsthand for themselves if they are in doubt that this is actually happening. And I look forward to hopefully seeing or connecting with people who may watch this video. So thank you. Bye.
Hello, everyone. My name is Andrew. You can find me on Twitter at RadicalPragmat1. And you also can find me on Savage Joy Show. You probably might recognize me on Postmortem Breakdown every Monday at 9:30. Anyway, I'm here just to quickly share why I support National Medicare for All. It's a couple of simple reasons, I think, that it just benefits anyone. First of all, under our current system, if you are employed by anyone, if you want to have affordable insurance and you don't qualify for Medicaid, right, you are most likely going to be put on your employer's insurance, right? And so that creates in a situation where you now feel indebted to your job. You can't quit your job because then you lose your health care, right? Medicare for all, already having insurance and not having to rely on your employer will change that, right? So that is one quick way that I support Medicare for all. Another is, say if you are seeing a doctor, say if you are seeing a therapist, and say if your doctor or therapist switch practices, right? If you are covered by an insurance that is out of network with the practice that your doctor switches to, you either can no longer see that doctor or you have to foot the whole bill, pay the whole costs out, right? With Medicare for all, you can actually keep your doctor. Unlike what Obama said under Obamacare, right? You actually can keep your doctor if you like your doctor under Medicare for all, right? And I think this really intersects into how, mental health and universal health care, Medicare for all in particular, really intersect, right? Because if you feel like if you are in a job that's being abusive in one way or another, you can quit and not worry about losing your health insurance, right? That's good for your mental health, right? If you are seeing a therapist and your therapist has to switch practices, you can actually, with Medicare for all and being covered, right, and not having to pay out of network, you can switch with your doctor, right, or your therapist, doctor, whatever, and not have to worry about being introduced when you are in a vulnerable state to someone else, right? And so, I could go on as to why I believe Medicare for all is the best option. But I think that really speaks for it. Here in Massachusetts, right, even with the most people covered, right, there are over 200,000 people who are not covered in Massachusetts, right? That's a mid-sized city. That's bigger than Worcester, which is the second biggest city in New England, right? That 200,000 is a much bigger population than Worcester is. So that is why I support Medicare for all on a national level. Everyone needs to have health care. It is a human right. Thank you very much, and appreciate Savage Joy for you doing this very necessary panels. Peace.
Howdy, y'all. My name is Novy, and here is why I support Medicare for all. Healthcare is a fundamental right as governed by the UN Charter, and it is guaranteed under our Constitution under the qualifiability and the right to pursue happiness. So, why don't we have it? Technically we do for our kidneys back in the 70s, but even that's taken over by the for-profit industry. And if we had something like Medicare for all, a truly nationalized healthcare system, everybody would be covered. Also, there wouldn't be as long lines for doctors, because instead of having to mess around with insurance and trying to beg some bureaucrat to get them so that you can get the treatment that you need, they could just go and do what they do best, which is helping people. So it works out for doctors as well. The only people who wouldn't work out for is insurance companies, but I'm not too fond of them at all. Are you? I grew up in Texas. My dad has chronic health issues, so do I. And I have an intellectual and physical disability. So, before the passage of the ADA, it was very hard for him to get his medication, and as a result, he had seizures that were very dangerous. And at least on one occasion, he could have died. And because we were covered over our parents' insurance, He couldn't get his medication needed, and we couldn't get any treatment that we needed. With ADA, he was finally able to get his medication, but soon prices went back up, and you're in the same situation that you are before. I got accepted to go to school in Arkansas, and then I went without seeing a dentist for 7 years because I went from being on my parents' insurance but having to travel 5 hours to see a doctor when I didn't have a car to not having insurance at all when my father turned 65. During that time, I sustained many injuries that if I had been insured, I would have been treated and I wouldn't be in a rollator today. And my story isn't uncommon. I finally went to Louisiana and I got for grad school and I got on Medicaid, and whereupon it saved my life. There's a good chance I would have died if I hadn't been on Medicaid at the time. And then lost it because I finally got a job where I made just slightly over the Medicaid limit. My story isn't unique. There are millions of people across the U.S. who are underinsured or not insured due to circumstances of employment and their family's history and other things like that. These are things that were supposed to have been made illegal back in 2012 and weren't. We need a national healthcare system. Everybody should be covered. Everybody has the right to live a long, healthy life and not have to deal with all these damn loopholes. So please, support Medicare for all. Thank you.
Great crowd. Thank you all for joining us in this march and in this fight. My name is Dan Gallagher. I want to introduce you to my mom. This is Ann Gallagher, and thank our graphic artist Shane Willis, who put together this awesome graphic that looks right out of Hollywood's golden age. So when we rang in 2020, I don't think any of us really knew what lay ahead of us. Beyond the daily challenges of dealing with COVID, I also learned that my mom would not make it to the end of 2021 and dealing with her end-of-life care. Mine is the story of discovery of a rigged and broken for-profit healthcare system where our seniors are prey to the health insurance predators. What I was about to discover shook me to my core and is a decision faced by millions of families all over this country. Simply put, how to care for a parent when Medicare does not cover long-term care. You probably recall Bernie Sanders talking about this during the primary. My mom was 93 and had dementia and lost her ability to swallow and was slowly wasting away. She needed 24-hour skilled care. After a short-term stay in a hospital and a rehab center, where I couldn't visit due to COVID protocol, I was told my mother was being released and to come pick her up. Although she had both Medicare and private insurance, if she wanted to stay beyond her official discharge date, it would cost $650 a day with a $20,000 deposit. I realized at that moment that I stood between my mom and a facility probably out of a Charles Dickens novel, or maybe even the street. However, this is the rigged part of our healthcare system. A good quality nursing home or rehab center is more than willing to keep your parent. All you need to do is sign over their assets like their home to the state. They even have all the forms ready to go, which I was kind of blown away by. You know, those same assets that your parents worked hard for all their life to hopefully leave to their children when they pass away. So our for-profit healthcare system now even targets middle and working class generational wealth. I then became my mother's unskilled 24-hour caretaker in her home until her death last October, with minimal visits from hospice nurses and caretakers. And let's face it, not everyone has the ability to drop everything and be your parents' full-time caretaker. And I did not know at that time what kind of commitment I was getting myself into. And I thought, why is that? Unless you're in the 1%, there truly are no good choices. And why do we have no good choices? And it's because our system is a broken for-profit healthcare system that's rigged for the health insurance industry executives. But the good thing, I suppose, is when you're in grief and you're stressed out, and every day you're just like you're living moment to moment. You lose your filter. So every doctor, nurse, home health aide, social worker that I came in contact during this process, I would say, our healthcare system is totally broken. And you know what? Not one of them disagreed with me. So in concluding, I just want to say our for-profit healthcare system is cruel, shameful, broken, inhumane, and totally unacceptable in what is the wealthiest country in the world. Healthcare should never, ever be for profit. It should be for the people. Thank you so much for hearing my story.
So that other video clip was from a longer video that I did about mutual aid crowdfunding that I do a lot of on Twitter. But as far as Medicare for all specifically, to focus on that for a minute, it is actually, to me, the most important issue, and that's for a lot of reasons. I do strongly, strongly believe that healthcare is a human right for every person, no matter what their situation or even their personal beliefs, whether vaccinated or unvaccinated. Either healthcare is a human right or it isn't, and I believe it is. And for me personally, Medicaid, in my opinion, has saved my life more than once. And I don't really think that I would be here today without Medicaid, which is one of the reasons that I strongly believe everyone needs it, everyone deserves it as a human right. I've dealt with a lot of physical and mental health conditions my entire life because of lifelong physical and mental abuse and psychological abuse for 20 years, and then even sexual abuse for the first 28 years of my life. So because of that, I ended up with more comorbidities than I can even count. Chronic major depression, severe anxiety, CPTSD, autoimmune celiac disease, fibromyalgia, malnutrition, anemia, but the thing that really prevented me from being able to work anymore was a physical condition that I wasn't even aware of. I didn't get diagnosed until my 30s. I had endometriosis for so many years, and it had gotten so bad that I could barely walk. I wasn't able to work anymore. I was waitressing, and I wasn't able to lift anything to waitress, so they had me rolling silverware, and then I got to a point where I couldn't even lift the bin of rolled silverware, which was only 10 pounds. And at that point, I realized that I just could not work anymore. And I was in my late 20s by then. I was still in an abusive relationship, an abusive family situation, was not able to be financially dependent. I've actually never been financially dependent in my life because of that. And at that point, I did stop working, and I dropped out of college. And honestly, that probably would have been it. Like, I would have worked myself to death not knowing that I had a non-cancerous tumor growing bigger and bigger in my abdomen because of endometriosis that had gone untreated for so many years. Literally almost a decade of severe endometriosis, fibroid tumors that just got bigger and bigger and bigger to the point that I could barely walk. I couldn't get any schoolwork done. So I quit college. I immediately went looking for Medicaid and food stamps. I never had the courage to do that before because my abusers wouldn't allow it. They had taught me that any government handout was even though I was an adult, they prevented me from taking care of myself with my physical or mental health or getting Social Security or getting food stamps. But when I became pregnant, I took the responsibility to seek those things out myself anyway. And because of that, I got approved for Medicaid and food stamps and was able to start taking better care of myself. I was able to see a psychotherapist for the first time in my life, and they diagnosed me with severe chronic depression that I've had since I was 12, and severe anxiety disorder, and CPTSD, and possibly OCD. And they put me on antidepressants, which a while later I changed the dosage, and they changed the dosage to like twice what it was before, and I'm finally in a place where I feel like my depression is managed because of those antidepressants, which I only was able to get because of Medicaid. And with food stamps, I was able to take better care of myself. And it also allowed me to see any doctor that I needed to pretty much was covered by Medicaid. And I was able to see a primary doctor that I really liked, and they set me up with all the specialists that I needed to find out that I had severe endometriosis and a tumor growing in my abdomen for years that then was getting worse because of my pregnancy. The pregnancy hormones actually caused this abdominal tumor to grow massive, and I had it through my pregnancy and after his birth. It was literally, by the time Grayson was born, it was a mass the size of an orange, according to the surgeon. And it was attached from my uterus to my abdominal wall to my bladder. And it was just a mess. The surgeon held up his hands and said it was like this big, the size of an orange. And that surgery, I can't even imagine what it cost. Having Grayson in the hospital, there was also some complications because I was a high-risk pregnancy the whole time. I didn't know that it was because I had this giant tumor this whole time that I was pregnant and going through labor and everything. It was like being pregnant with twins, and I didn't even realize it. So Grayson was fine. He was small. He was actually a week late and still very small. He was only 5 pounds, 11 ounces. But as soon as he was born, I had extremely dangerously high blood pressure. I can't remember the name of it now. But it was very high, very dangerous blood pressure, preeclampsia, I think. And it could have caused a stroke. So they put me on magnesium and kept me in the hospital for an extra 3 days. Having a baby without any complications in the United States is an average of $10,000, if you didn't know. Being there for an extra 3 days and having, extra medication and care, I have no idea what that cost because Medicaid covered it. Just like it covered my psychotherapy, and it covered my antidepressants, and it covered the specialists that I needed to see. It even covered some of my dental work because I had confirmation from my primary doctor that the number of comorbidities that I have affected my dental health. So I was able to get some dental work covered as well. which wasn't easy either. I had to fight that for a year just to get them to cover some basic things like basic deep cleaning and things like that. But in any case, I have no idea how many thousands of dollars it would have cost out of pocket without Medicaid. But I really truly believe that it saved my life and my child. So yeah, it is definitely the most important issue to me out of everything. I think I've come to realize that housing is probably the other most important issue to me, which is why I focus on crowdfunding mutual aid to help people with housing and just basic necessities and food. They should all be human rights, and every human being deserves it and needs it to live. And even just to live basically, not even to thrive and live a good life, but just to live a basic human existence, you need food and clean water and health care. When I finally got diagnosed and had Grayson, and my life significantly improved once I had health care. And today, I turned 35, and, we're still going, and Grayson just turned 4. So we're doing the best we can, but yeah, we've been in quarantine for 2 years now, living out in the desert. And we're doing the best we can, but we've tried to start a home business for income because we're still not able to work out of the house. My partner is also high risk. But I just wanted to say, absolutely, I believe that healthcare is a human right. And we should have it already. It's outrageous that we don't. So I hope we all keep fighting for it. I'll do what I can, even though I'm kind of mostly homebound, for now because of the pandemic. Best of luck to everyone, and my sincere appreciation and so much love and gratitude and solidarity with everyone still fighting for Medicare for all single payer. I love you guys, I appreciate you, and let me know whatever I can do to help make it happen. Thank you.
Hey there, guys. I'm Rick Overton, and I just want to remind everyone that we are in the perfect storm of circumstances that should remind us why we need Medicare for all. And that means all the Americans, even the ones you disagree with, and the ones that you feel are taking your tax dollars away for their issues and all of that, because they're human beings and they deserve to be kept alive in a civilized society, that which remains. So please, please, please support Medicare for all. It is really including you too, and that also includes the eyes, the nose, the teeth, and all the other things that we need, because that's all of us. So all of us, let's fight for Medicare for all of us.